Hi guys, Dr. Brotsky here. This is week 24 of your pregnancy. This is an exciting point to get to as far as obstetricians are concerned, because this is the point where we call this baby viable. And what that means is the baby has grown enough typically to actually be able to have some intervention and some support. God forbid there would be an emergency and we would have to deliver. So that's exciting to know that you're this far along where those things can be considered. Things you might expect to have right now are very regular fetal movement. Your belly's definitely growing and getting bigger. You're almost in your third trimester, so you're feeling a lot of pressure. You're urinating very often. That's very common and normal. Another thing people complain of pretty often is more frequent nosebleeds, or your gums may bleed more easily just because of the irritation from something as simple as brushing your teeth. So those things are very common, very normal, as long as they just stop in a normal amount of time within a couple of minutes with some pressure. But tell your doctor about those things if they concern you or if they're happening more often. You may also notice more swelling in your legs, like I've mentioned before, and as a result of that, you can develop some varicose veins. That's usually little dark colored veins that come to the surface in your legs, usually more commonly than anywhere else, although you can get them in other parts of your body too. So just be aware of those. Very common, very normal. They go along with hemorrhoids as well. So make sure your doctor knows about them so they can tell you how to best prevent them from getting worse. From a doctor's perspective about 24 weeks, we're gonna talk about screening you for gestational diabetes, like I mentioned in the last video. Along with that, we're gonna make sure you're not becoming anemic or anything else. You may also notice a dark line in your abdomen from your belly button down, and that's called a linea nigra. It's very common, and it's just an effect from the hormones. You may also have those darker colored spots on your face in certain spots. So that's okay too. Those things are very common, very normal. Your doctor may also remind you of the flu vaccine recommendation that we want all pregnant women to get at any trimester during flu season. So talk with your doctor more about that and make sure that everyone around you to keep you healthy and the baby is immunized and protected against the flu. Even more so important if you're exposed to someone with the flu who has tested positive for influenza. Just to be safe, we even treat pregnant women with Tamiflu typically, just to prevent your infection from arising and being severe. It lessens the severity and the duration of influenza. God forbid you're exposed to it. So things for you to be doing right now are to sleeping on your left side, enjoy feeling your baby move. You and your partner can definitely have fun reading to your baby. The baby definitely picks up on different types of tones and rhythms. So some people play music to their baby, some people read to their baby every night, and there's definitely a connection that starts to form there that's really important. So do all those fun things with you and your partner. And then the other thing to mention is just take precautions about influenza and being around lots of kids, for example. Maybe you're a school teacher, maybe you work at a daycare. So those things are good to take notice of because children can commonly carry viruses like this that can be very contagious. So just take those precautions. Wash your hands, wear a mask if you need to. That's it for week 24. Make sure you check out my other videos on the same channel, and you can find me on drbrotsky.com.